Serious doctors and therapists of Reddit, have you ever been glad that a patient stopped coming to you? What happened? Orthopedic surgeon here. Best, worst, patient shows up for elective surgery munching on a big cup of ice. Big nope. Tell her we have to reschedule her case. She throws a tantrum. But I have dry mouth and have to chew this ice. I understand, but we can't put you under with a belly full of water, risk of throwing up, and sucking all that stomach goo into your lungs and dying. Go back and forth like this for a few minutes. I say to her, you know, talking to you is like talking to a toddler. She didn't like that at all. Finally tell her to go home, and I leave the pre-op area. A few minutes later the nurse finds me and says milliseconds. Pain in the ass won't leave. She says she doesn't have a ride home. I give the nurse $20 to call her a cab. To this day still the best use of a 20 ever. Never heard from her again. Yes, but almost exclusively patients that are seeking controlled substances that I don't believe are indicated for their condition. I've never fired a patient, but I've definitely had patients that don't appreciate my attempts to wean them off their chronic opioids. Many patients with chronic pain are happy to try my suggestions. However, for those that aren't interested in reducing their dependence on these medications, I don't think I'm a great fit as their doctor. I had a patient that I saw quite often for a number of simple illnesses. She would often joke that she came in just because I was working the clinic that day, said she would check if my vehicle was outside. Over the course of several months I noticed she was coming in more often and with less clothing on. Short skirts, low cut tops. Last straw was her coming in with a loose fitting shirt and no bra. I fired her as a patient after that. Before I say anything, I have to say that working with people with mental illnesses or other difficulties is easily what I miss most about working in that field. Even in my limited experience, I had enough folks that were so genuine, eager to get help, thankful, and wanting to help with difficult research, to help others despite the shitty hand they'd been dealt, that it was awe-inspiring. Even with the folks you're glad to not see again, you hope the best for them. I told this story in another thread, but it fits here too because, even though I felt for her, I was still selfishly glad that she didn't come back. I used to manage clinical trials for some bigger name places. One of the last trials I managed required working with folks with schizophrenia, who were not on medication. To be fair, this story is not typical of those folks, and I don't want to stereotype them, but I'm just saying this to explain the behavior in this instance. The study involved 3 to 4 visits totaling 10 to 12 hours with these folks, so I got to know them fairly well. My portion involved an extensive clinical/diagnostic assessment and some other computerized tasks, so all told I spent 4-ish hours alone with them. The rest was taking them to other providers/apps for the study. This all occurred in a room that didn't have a panic alarm, and B, where I was not closest to the door, which are two big no-nos. I did bring it up when I first started but was younger, naive, and figured the odds of something happening in this context was low. I worked with upwards of 120 people and heard all kinds of stuff, like a little old lady who described her vivid hallucinations of people being cut up into pieces, slaughtering others, etc. Just as calmly as she talked about her love of scrapbooking. None of this stuff ever bothered me, largely because, even when people describe stuff like that, there are so many other indicators to tell you whether or not they are dangerous, and most of the time they're not. Several others were pretty terrified of the other portions of the study, not disclosing, but people without schizophrenia were afraid of it, so it was normal, but were so compelled to help our research so others wouldn't have to feel the way they felt, that it was inspiring. Then I had one who was incredibly obsessive. I didn't spend enough time with her to figure out if this was separate from or a part of her schizophrenia, but she ended up pinning me in the corner, grilling me in an aggressive but crying manner about why I kept asking her to come back to these appointments, but didn't want to date her. She had never mentioned this until this point. Again, no panic buttons, no way out. I'm a small guy, and she was taller and much larger than me. Thankfully her mom came to pick her up a little early, and it saved my ass. But it happened in a matter of a minute or less, and that's what scared me most. Suffice to say, I told my supervisor I would not be continuing that study until he rearranged the clinic, so I was closest to the door, and we had a panic button/protocol in place. Other notable mentions were students trying to game the system to get disability accommodations when in reality they were just lazy and entitled. A minority to be sure, but it still happened, and was almost always paired with one of their parents calling me to demand things from me for their precious little unique child, and how dare I not give them what they deserve. Thankfully at the university level I didn't have to tell them jack given privacy laws. In my homeland, I used to run an outpatient clinic together with several other GPS. The patients can freely choose which doctor they want to visit, or if they are regular patients, to change doctor if they want. Somehow, I was always stuck with annoying patients, like those who were over-demanding, tried to steer the doctors on what to examine, and what to prescribe, impossibly uncooperative or non-compliant, hard-headed and in complete denial, like to argue back, all you can name it. Most of them are also doctor shoppers, and like to boast about that, a clear red flag. Usually, most doctors would try to be sugarly sweet and nice and suck up to these patients no matter what, but I just couldn't. I treated them like any other patients. Yes means yes, and no means no. We can discuss the medications and course of examinations, but you can't steer me around like a car, and have it all your way as you please. Most of these difficult patients were often displeased, and somewhat crossed by my policy, yet they keep returning to me, despite me giving very clear sign I'm never going to treat they specially, or give in to their demand. Eventually, after several consultation, a lot of them would never return, which was completely expected from their doctor shopping behavior. I always feel a lot relieved, while wondering why they didn't go away sooner. Even my colleagues and nurses often joked, whenever a new difficult patient came, saying my calling had come. A couple of years after becoming an attending surgeon, I had this miserably pessimistic patient with mostly problems related to self-neglect. She was agoraphobic, barely left her house, and a glutton for misery, basically refusing to do anything that might better her circumstance. She came to see me because she had a gastric bypass somewhere else in the past and wanted continuity of care. One day she hands me an envelope and tells me I've been served and that she's sorry her husband the process server couldn't ever catch me at home because I work too much. It's true, I was working quite a lot because my wife of 12 years was being insufferable since we had moved away from her best friend in Miami for an incredibly better quality of life and work situation. Anyways, they were divorce papers and my wife was leaving me to marry her friend's brother, which I was already anticipating. It worked out well, because then I was free to start over fresh with someone who shared my current priorities. Now we have 3 kids and a great life of rewarding work for only half days, frequent travel and leisure, and 3 awesome young children. The miserable patient didn't feel comfortable having me as her provider after that, even though I offered to continue to do so. Huge win on all counts. I used to practice in a clinical situation where most of my patients were older or elderly. It didn't happen often, but the patients that I would always dread seeing were the ones who were starting to lose cognitive skills and memory abilities, but had absolutely nobody else I was legally authorized to speak about their care with. Spouse was deceased, no kids or kids were estranged, etc. Appointments could often turn into he said she said, so it would take me forever to write reports for those patients, because I essentially had to include every word said by either of us into the report to document that I told them something. For when they inevitably returned later on complaining that I never told them that exact thing. I'd never wish anyone harm, but I did occasionally find myself searching local obituaries when I'd realize I hadn't seen certain patients like that in a while, in the hopes that maybe I wouldn't have to. Pro tip, the mean ones never die. Totally mundane anecdote. Had a person who insisted on regular contact, no cost to them. They received general support from our service, but wanted a regular appointment with psychologist. Didn't really have a purpose other than a general chat, basically just encouraged spacing out appointments, and then at some point they just decided they couldn't be bothered walking in. It's kind of surprising how draining it is to have a benign, but knowingly unuseful appointment on the regular. Tons of times. The whole department was glad when a certain rude PT's insurance changed. They recently switched back, because of course they did. We're awesome, but the nurse who dealt the most with them cried and said she couldn't do that again. Nothing that stands out to Reddit. Standard threaten everyone's jobs and safety everything they come. and be demanding to an absurd degree, and take 1+ hours of our time for a 20-minute apt slot, and threaten to call the director if we didn't bend over backwards. But PTS like that one are frankly common. You just don't quite see them every few weeks for benign chronic conditions that can be managed with a yearly follow-up. Another person was disgusted that we wouldn't see them for free after they realized they had to pay a copay to see us, and acted like it was our problem to fix. Doctor stuck by her guns, and the lady failed filing a complaint with the medical board for us telling her to pay her part. I feel terrible saying it, but anyone with a personality disorder, especially cluster B eater, I should say, that I'm doing inpatient psychiatry right now, and you can't really do anything effective with people who suffer from personality disorders in less than 5 days. Outpatient is a completely different story. Just a recent one that popped into mind. Had a lady in her 40s come in the other day who had an extensive and complex medical history and some psychiatric illnesses. She showed up 15 minutes late, so by the time I brought her in, the next patient hosternate was already there. She had a list of about 6 things she wanted to go over. We got through a few of the issues, and then mainly focused on her issue with some pain on being on and off for 6 months, and she wanted antibiotics for it. She refused to supply a urine sample or undergo an ST screen. About 2 weeks later I got a note from the nurse that the lady wanted to lay a big complaint about me because I didn't check her blood pressure. Apostrophe. Like, holy shit, you have 6 things you want to get through in your 15 minutes, you show up late, and so I could have declined to see her and just asked her to reschedule, and now you are angry at me for not doing something that would take more time and wasn't even relevant to the consult. So happy she never came back. Another one, quite recently too. Had a guy who I had seen once before for something minor say that he has been getting short of breath on walking only 20 meters, despite just walking in from the waiting room with no sob at all. He said it had just started a couple of weeks before. So I go through the main differentials, basically wondering if it is a lung thing or heart thing, and order some blood tests to help decide if he needs to see a cardiologist or respiratory specialist. The next day I arrive to work with a message in my inbox, and his wife is furious that I hadn't referred him to a cardiologist. She is thinking about filing a complaint to the Ministry of Health or going to the local member of parliament because they aren't getting the help needed. This got me very worried because I'm quite a new doctor. I call her up and she basically says he needs to see a cardiologist because of his cardiac history. I'm like, what cardiac history? She sends through the notes that basically say that this issue with shortness of breath has been going on for at least 3 years, not 2 weeks, and he has seen cardiologists 4 times and has had extensive testing done, including a few ECGs, to which are cardiograms and a stress echo as well as an ECG, all of which were completely normal. So I'm thinking this guy really needs to see if this is due to his lungs. The cardiology note states that they think the same, and they have referred him for spirometry 3 times and he declined to go. The wife said they would be changing practices because of this. I really try to do what's best for my patients and try to decide the best approach possible in our meager 15-minute appointments, but when patients like this make it difficult, it makes me feel so helpless. Then to know these patients would also try to have you lose your job at the drop of a hat, it's not a nice feeling. Friend of my parents who is a therapist told me this story when I asked her about how she coped with her patient's suffering. She told me that there was one patient she had and wished she would never have met, through no fault of his own, though. She wouldn't give me much detail, of course, but this is the gist of the story. She had a patient who came to counseling after decades of trying to cope with his childhood on his own and failing. It took quite some time for him to finally be able to tell her how he had been terribly abused as a kid. He proceeded to tell her about all the horrific things that had been done to him. It was absolutely terrifying and heartbreaking that anyone could go through this, and according to my parents' friend, it was surprising he even could survive. The horrors the patient described made a lasting impression on his therapist and started messing with her badly for some reason. She was not used to treat trauma of this kind, and it came to a point when she would be reluctant meeting her patient because she knew he would talk about things that frightened her. She didn't want to break his trust, though, and he really needed the therapy, so she said nothing. after a while, however, the patient noticed that he was unwillingly making her uncomfortable and mentioned it in a session. They both agreed that she couldn't help him in these conditions and it would be better if she referred him to colleague. She told me she was quite relieved not having to deal with this patient anymore, but at the same time felt inadequate and unprofessional for being frightened by his pain. Neither a doctor or therapist, but I'm a manager at laser hair removal clinic which also does chemical peels. We had this one client who we will call Dumb Bitch, DB. So she would come to use for treatment for laser and go to one of our therapists. Now typically our clients will always see the same therapist for consistency, but this time we couldn't. After the treatment, she complimented our therapist, and then when our therapist left, DB said to our receptionist that she was terrible and wants to see someone else. Okay, cool, so we booked her in with the next therapist, and during her treatment, she just starts bitching about her previous one. Comes out and compliments our therapist, then asks to see a different one. Like what? She then starts bitching to the next therapist about the previous two. She did the same pattern through all 5 of our therapists, and then goes back to her original and bitches about the other therapists, and says you're the only one I like, the others are just horrible and you're the nice one. Now she said some very racist and harsh remarks during her bitching, so I had to talk to her about it, and tell her that we cannot treat her anymore. She called us all cunts, and then had a nerve to call us up for a refund which was declined.